Where did you have that?
From Calicut.
Okay, Calicut, right. And you had the accident in April 2021. And they took the rib from the right side? Okay. And now you want me to improve the shape and the tip and everything else, all right. So here we have an interesting case because he's already had a road traffic accident which resulted in the deformity or the issue with his nose and the region around it. And he's had a surgery a year ago elsewhere. Of course, there's a lot of improvement. I'm just going to explain the problem with his nose. So first up, you see, you can very clearly see the outline of this nose now, the dorsum as we call it. That's the rib that you can see clearly. So you see it's attached here, and it's looking like as if something is being done to his nose, so it doesn't look very natural. So in this revision rhinoplasty, I'm going to shape this more correctly. The other thing you notice is the scar is really tethered onto the bone. So while we do the dissection from inside, I got to keep a layer of cartilage to make sure this skin is not going to get attached to the bone and therefore causes puckering or tethering. The next concern for him is his tip. You see, this is the bony tip here. I can feel the bone end there, but his real tip is here. So there's a mismatch with the tip. So we're going to do a tip work to match this graft and also the tip of the nose, and also do a little ALR work so that we improve the height, reduce the width, make this thing proportional and correct, and also give him a much more suited nose. So we're doing few things here. First, it's going to be augmenting this part, reshaping this part on the dorsum, a defined tip, removing the puckering, reduce the width. So that's the plan for him. So because it's a revision procedure, because he had a road traffic accident already and everything, we still have to bank on the rib that we're going to take. So it'll need rib grafting also. This is mostly into reconstructive nose job, but still again cosmetic as well, because what he's desiring is mainly improvement in the shape of his nose. The second thing here is this scar that you see that's puckered. So I can't improve that at the same time. I just explained that to you, right? Because that scar has to be dealt with separately from outside and not at the time when I'm operating from inside. So you need to have proper vasculature, right? You can't do both from inside and outside at the same time. That's going to cause mess with the graft. Chance of infection is higher and can lead to a similar issue later on. So first we give the shape. This puckering will go, depression, everything. After about a minimum of 3 months, maybe 6 months, we can look into that scar. And again, that scar is not going to totally disappear. The shape of the nose we can improve a lot. We can make it like really nice. You can also give me the shape of your nose before the accident when you come for surgery. So that will be useful for me to plan exactly what we're doing, okay? Do you have any doubts?
Sir, this side and this side, like...
Yeah, I'll make it symmetrical.
Here also, sir, this side is somewhat big pose and this is...
That's because the graft is not on the midline and the tip is different.
Sir, then lips also, sir. When I take photo, no, this lips are drooping one side.
Lip, I won't be able to do anything. We're just going to do the nose. Yeah, we'll not talk about lip, nose, nothing, just the lip.
Sir, when you are cutting the scar, no, you could make my lips looking opposed, right?
But that we can do during the scar revision, not during the
After
rhinoplasty.
3 months, sir.
Minimum after 3 months.
Sir, when can I do this procedure, sir?
When do you want it?
Maybe, like, I want to know how much will it cost, sir.
Yeah, so you can meet our executive. He'll tell you the dates and he can also tell you the cost and everything. Right?
Thank you.